Hi there, I'm Kennedy, and I'm going to be giving a brief presentation today on the incidence of workplace violence, specifically for ER nurses. So I wanted to begin by reviewing what workplace violence is. We'll look at how frequently violence occurs in the ER, and then we'll also look at what workplace violence encompasses. So according to Harding, we see that the slide says that workplace violence is the acting out of the emotions of fear and or anger to cause harm to someone or something. According to Steen, from an article published in 2015, workplace violence encompasses any act or threat of physical violence, harassment, intimidation, or other disruptive behavior that occurs at the work site and may cause physical or emotional harm to any number of healthcare members. Therefore, going back to that original definition that we looked at from Harding, we oftentimes see patients lash out aggressively, and according to this definition, we can come to understand that it may not be a result of anything we do or don't do as nurses, but instead is based on their emotions of fear and anger. Harding also explains that this fear or anger may be a direct result of organic diseases. For example, temporal lobe epilepsy could be a cause of these emotions. It could be the result of psychosis in a patient with schizophrenia, or it could be criminal behavior such as assault or battery. As nurses, you guys are probably aware of the variety of patients that are seen on a given day, patients from different backgrounds and with different diagnoses. So it's important to identify possible causes or risk factors that put someone at increased risk for workplace violence. Currently, the incidence of workplace violence for ER nurses is about 70% of nurses who have reported being hit or kicked while working, and that's according to the Emergency Nurses Association. In a different survey from 2004, they surveyed 6,300 nurses, and they concluded that a rate of about 52 to 100 nurses per year will experience violence at work, so about 50%. And then just to provide more evidence to the incidence of workplace violence for ER nurses, we also see a survey from Steen that highlights that 25% of ER nurses claim that they were physically abused 1 to 10 times in a year, while 70% claimed they were verbally abused at work between 1 to 10 times within a given year as well. Now, according to Steen, just to clarify a bit further, physical abuse that has occurred and been reported could include things like hair pulling, biting, getting hit, punched, slapped, being hit by a thrown object, being kicked, pinched, pushed, scratched, sexually assaulted, shot at, spit at, stabbed, or voided on by a patient. And then examples of verbal abuse that has been reported include being harassed, sexual comments being made, being sworn or cursed at, threatened with physical harm, verbally intimidated, yelled at, called names, and more. Therefore, after hearing the things that we did in that last slide, it's imperative for us as nurses to discuss the ways that we can advocate for nurses' safety and ultimately reduce those alarming statistics that we just saw. So there are some current practices that are being implemented in various hospital settings to help keep nurses and other healthcare members safe. So according to Harding, these practices include the use of on-site personnel, security members or police officers, metal detectors, surveillance cameras, and locked access doors that all can aid in keeping nurses safe. However, according to the American Association of Critical Care Nurses, there are strategies that nurses can also individually implement to help keep them safer at work as well. So nurses should participate in educational training such as this one to remain up to date on practices and prevention strategies that they can implement themselves on a daily basis. They should also stay up to date on facility policies, procedures, and crisis plans. Nurses should always report right away if some type of workplace violence act occurs to them. They should be supported and encouraged to press charges if they or you are assaulted. You should always support your coworkers who are also experiencing violence, and you should try your best to work together as a team to seek solutions to prevent and reduce possible incidences of workplace violence. So, according to an article by the National Nurses United, there has been some changes that have been made to help support and advocate for ER nurses at the legislative level. The National Nurses United Union just recently announced its support of the new bill that would mandate that the Federal Occupational Safety and Health Administration, or OSHA, would create a national standard requiring healthcare and social service employers to develop and implement a comprehensive workplace violence prevention plan. However, even with this bill and the mandate by OSHA, some hospitals and facilities still fall short of creating and implementing a workplace violence plan for their workers. And so this just again highlights the importance of advocating for ER nurses and their safety while at work. So some have called the incidence of workplace violence on healthcare workers a worldwide epidemic because of how many people have been affected by violence in the ER setting specifically. I want to highlight the ethical implications as well as the social justice aspect kind of together to emphasize the need to report any incidents of workplace violence. I want to point out that there is a large percentage of nurses who experience workplace violence and don't report it. So, according to an article written by Steen, nurses claim they don't report workplace violence incidents because of any number of the following reasons. So, they feel nothing will happen even if they do report it. They think it's part of the job. They think it takes too much time. They're too busy, and violent acts happen too often. Some report not even knowing that they were supposed to report incidents of violence until recently, and some fear that they won't be supported by leadership. Therefore, this emphasizes the importance of being educated, knowing facility policies, and advocating for oneself to ensure a safe work environment. I believe this is a social justice issue because of the fact that ER nurses should be subject to the same safe working environment as every other employee that has protection at their job. It should be a priority that ER nurses are just as safe and protected as everyone else in various occupational settings, especially since it impacts so many nurses as well as their subsequent patients. Therefore, it's important for nurses to advocate for their own safety in the workplace and demand that the same protection mandates and policies be put in place that protect ER nurses from workplace violence that maybe every other work might already have in place. In order to improve healthcare in general, it's important that nurses recognize the importance of reporting all acts of violence, as well as remaining engaged, staying up to date on training, education, making sure they're aware of hospital policies, procedures, as well as ensuring that they are doing everything they can to help curb the incidence of workplace violence. Kind of doing this together, supporting one another, and continuing to advocate for the safety of nurses will only continue to improve the outcomes of reducing and preventing workplace violence incidences, and then overall will hopefully positively impact healthcare for the future. Overall, we've looked at the ways that nurses are impacted by the ways that workplace violence impacts them and ultimately the safety of their other patients. We understand that if nurses sustain injuries, are emotionally disturbed, or hurting from any type of workplace violence, they're not able to care for other patients, and this then creates an unsafe environment for everyone. Therefore, the public and hospital administrators should work together to do more to support and advocate for ER nurses' safety. However, as we saw earlier in this presentation, there are things that nurses can do to be better equipped and prepared to handle workplace violence if it ever occurs to them. And I hope you were able to take something away from this presentation in order to prevent or reduce workplace violence as well. Thank you. And here are my references.